My name is Sarah Otieno, and thank you so much for tuning in to the show today. For everyone who's texted in about NCIC, we will be sampling some of those responses that you have actually texted us and talked to us, giving your opinion. But for now, we talk about a matter that is dear to all of us, dear to all of our hearts. When you talk about matters of the health sector, tomorrow is the World Cancer Day. And for that reason, we want to look at the state of our country when it comes to this disease. How many people are being affected? What really is our position as a country when it comes to cancer? And that is why today I'm joined by Dr. Joseph Githaiga, who is a surgeon that deals with cancer and especially breast cancer. And he's here to shed some light on this issue. Hello, Dr. Joseph. How are you?
I'm fine. Good evening, everybody.
Good evening to you too, and thank you for making time for the show today. So, as we celebrate the World Cancer Day tomorrow, I just want to hear from you as an expert. What are the major types of cancers that are frequent in our country?
If you are to take all the cancers combined, the most frequent cancers in our country are head and neck, head and neck cancer. But if when you look at the gender among the male and female, in the female, cervical cancer followed by breast cancer are the commonest. While in the male, we have cancer of the esophagus, that is the pipe that swallows, that you use for swallowing food.
Yes.
Followed by prostate. Those are the commoner cancers. And then, of course, you have in both sexes, then you have the cancers of the large intestine, or what we call colorectal cancers, and then cancer of the stomach.
Well,
and then, of course, those are now the solid, those are what we call solid cancers. Then you have leukemias also being among the top 5 cancers. That's blood cancers in the country. Yes.
All right. And most of the people, when you talk about leukemia, they'll just think of blood cancer. That is how we refer to it. But you've made it very clear that for women, it's breast and cervical cancer. And for men, it's esophagus and the prostate cancer, if I'm getting you right.
That's correct.
All right. Now, I want to know, young people recently, both male and female, are actually suffering from cancer. And cancer kitambo, it was known as the disease for the 50-year plus. You know, that was the notion that we had. But right now we have young people who are suffering from cancer. Maybe what is the cause of these rising cases amongst the young people?
I think a lot might be occasioned by lifestyle change. Most of us have now approximated the Western style of life.
Yes.
Yes, and then, of course, I think we are picking more cancers among the young because of surveillance and screening, which maybe we never used to be very, very effective. But still, when you look at most cancers, they tend to affect the elderly. And as our life expectancy increases, we are seeing more and more cancers among the older people. But you do have a special subset of cancers that are called childhood cancers that will affect children. So it's nothing new. That is something that has been happening. But of course, certainly there's been an increase in the incidence of cancer. And it's estimated that by 2030, about 80% of cancers will be in Africa, in the developing world, and also will account for the highest cause of death.
Okay, and maybe that is where I wanted to go next. But before we look into that, there is this issue that you have highlighted, the childhood cancers, and you said this affects also the children. Maybe highlight a little bit more about that.
Of course, leukemias are fairly common, especially what we call acute leukemias. Acute myeloid leukemias, they are very common in children. In fact, they tend to affect younger people. Then you have renal cancers. These are nephroblastomas. Yeah. You also have cancers that may affect the bones. Osteogenic sarcoma. Sometimes they can affect children. Yeah. And then there are other, we call them sarcomas. These are soft tissue tumors.
Yeah.
Again, it can be fairly common in children. And then lymphomas. Lymphomas, some of them can actually, you can get changes from leukemia to lymphomas. Yeah, in some instances. But lymphomas affect our lymph glands. These are the glands that help in protection against infections, and they are fairly common in children.
Well,
yeah, and maybe a fairly common variety is what used to call Burkitt's lymphoma, and we also have what we call Hodgkin's and non-Hodgkin's lymphomas. They're also fairly common in children. Yes.
Okay. All right. And you know what? When I'm thinking about this, I'm actually having parents in mind. Sometimes maybe our children could be exposed and we do not even know. Maybe they're suffering from cancer and we do not know. And I want us maybe to highlight on some of the signs and symptoms and the most common ones cutting across any type of cancer that maybe as a person I should be on the lookout for.
Okay, since cancer is very heterogeneous, it's not just one disease.
Yeah.
Yeah, and it will affect different systems. And so the presentation will be as per that particular system. So for example, if you have a breast cancer, you probably have a lump in the breast, which might later form a wound, before it spreads further. If you have cancer of the cervix, some of the early symptoms might be vaginal bleeding during intercourse or even when straining. Yeah. If you have cancer of the large intestine, you may have problems with passing stool, maybe passing bloody stools. You may even have complete obstruction so that you cannot completely open up your bowels, and sometimes you may present as an emergency. So the presentation will really depend on what kind of cancer or what system is involved. Lung cancer, you may present with you may be coughing blood. Yeah, stomach cancer, you may find that these people first, they'll have abdominal pain. They'll probably be eating and then feeling very full. And then they may end up with vomiting. So it really depends on what particular cancer that you have. But most cancers, when they advance, one common thing they'll have is weight loss. If you find someone who is having unexplained weight loss, they're not losing weight, they're not trying to lose weight deliberately, they're feeding as usual, and yet they're losing weight, then you need to, that should alert you, and you should start thinking what is going on. If someone is losing blood, you find that, yes, and you cannot get an obvious explanation, then again, you have to start thinking about that possibility.
Okay. I'm getting you correctly, but sometimes you would come across a patient who has pale eyes, and sometimes we just get across these people and we conclude that huyu akona cancer. Is it right? Is it one of the signs that this person is actually suffering a type of cancer?
No, when people have pale eyes, or what you call pallor,
yes,
it means that they don't have enough blood. So that could be from any reason. Yeah, it could be from the fact that they are losing blood from somewhere. That might be related to a cancer or not. They might be passing the blood in urine, or they might be having leukemia, or they may be having, or even just nutritional deficiencies. They're not getting enough, so that they don't make enough blood. Women may be having just heavy menses, and that again can lead to them having pallor. But it's a very important sign that should not be investigated, that should not be ignored. Anybody coming with pallor, loss of blood, once it's established, then you want to find out what kind of anemia, because when you have low hemoglobin levels, we call it that anemia. You want to find out what kind of anemia it is, because that again can give you a clue as to what is causing this. Because most of these are usually what we call iron deficiency anemias. Others might be related to vitamin B deficiency, and others are just due to loss of blood. So you need to find out exactly what is going on. So people should not just be walking around with low hemoglobin levels. The commonest thing, of course, especially in the less endowed parts of the country, is actually worm infestations, ascaris.
Whoa.
Mignon.
For real? Mignon can cause someone to have pale eyes?
Of course, because the mignons take your blood.
Yes. Oh.
I'm forgetting they're in your gastrointestinal system. They're in the intestine. They can actually make you, lose quite a bit of blood.
Wow.
But that's an important symptom. That's an important sign that should not be ignored. You should be investigated until the cause is established.
All right. I like that part, and that means a lot of people should actually be deworming very much frequently. And just away from that kidogo and into a topic that maybe you specialize in, and this is the issue of breast cancer. Now, someone would say, and I know that a lot of men don't go for breast cancer screening because they say this is something that only women should go for. Maybe this notion, this notion that people have that men should not go for breast cancer screening. What do you have to say about that?
Well, the truth of the matter is that in some instances, 1 out of every 20 cases of breast cancer will be in the male. And in some situation is 2 out of 100 breast cancer cases are in male. So yes, males do get breast cancer. And it's just like in any other aspect of your health. It's good to be aware about what is happening in your body. So if you touch and felt there's a lump in your breast and you're a man, you should be definitely investigated so that you find out what it is. Because we do see, it's not very common, but we do see men coming with breast cancer. And unfortunately, when men have breast cancer, they tend to present when it's very advanced because the male breast is small. So it will spread fast locally, it will spread fairly quickly. Before long, it has disseminated into the blood and is in other organs.
Now,
so
sorry, carry on.
It's something that you should be aware of. Now I'm saying it's something that you should be aware of, and men should also be aware that they can also get, because they have breast tissue, so they can get breast cancer.
So maybe they might be scared of the process of screening. So as an expert in this field, how is the screening done? For wale wanaume ambao wanasema, that medical procedure might be the reason as to why I'm keeping away.
You don't need to have that very rigorous screening.
Yes.
But whenever you go for your yearly checkup, there is no harm in your doctor examining your breast, really. There should be no reason why not. And maybe because you are a developing country, we have so many problems that a well-personed clinic is right at the bottom of our wish list.
Yes.
While in developed countries, people will normally have an appointment once a year to have a check, just to make sure that they are okay. So if you can, you should at least have a well-personed check. Once a year. And for a male, important things. One is the examination of the prostate, especially if you're over 40. And then, of course, at the same time, you get the rest of the body examined, including the breasts.
Okay. All right. I want to ask you a question that has been asked by Phyllis Ndungu all the way from Saudi Arabia. She's watching and she's asking, is cancer transmitted? Hello, Dr.
Hello?
Yes.
I think I'm not getting you.
All right. This is Phyllis and she's asking if cancer is transmitted.
Yes. What is the question?
The question is cancer transmitted? Can it be transmitted from one person to another?
About that, one person to the next, no. What we know is that, first, if you look at cancers in general, about 90% of cancers are what we call sporadic cancers, meaning you're getting changes in the genes, or what we call mutations. Something goes wrong with the genes. For the first time in that family line or in that person. We all have abnormal genes, but our body has mechanisms of correcting this. But sometimes these genes, then we are not able to control them, and we may end up with cancers. So majority of cancers are what we call sporadic. Then 5 to 10% may be genetic, where people pass on defective or cancer genes from one generation to the next. And what has been quite well studied, for example, is breast cancer, where we some two main genes have been identified called BRCA1, BRCA2, and these are passed from mother to daughter. Yeah, and you find that, and you do get you may get several members of the same family, fairly close aunties, sisters, all having breast cancer. And then, yes, and this is actually genetic. And maybe one of the communities that was very well studied called the Ashkenazi Jews, where most of them, the incidence was so high that a lady had an 80% chance of developing cancer in her lifetime. Being a gene carrier.
Yeah.
So, but these are not the common cancers. Common cancers, majority, are sporadic, and these are caused by environmental factors, infections, and also chemicals that cause cancer.
Yeah.
And probably related to lifestyle diseases. So, in a way, these are cancers that can be preventable.
Okay. Well, I'm getting where you're going with this, and maybe I want to ask you. You know, they say about 30,000 people die of cancer only in Kenya. Now, I'm wondering, why is this number so high? Why is it because our health sector is not strong enough to handle this disease? Why is the number so high?
Well, the truth of the matter is that we have fairly serious challenges when it comes to management of cancer. We can put these problems into several reasons.
Yes.
One is facilities. Lack of facilities for treatment. Because there was a move, all governors were saying they're going to put up cancer centers. But if you look, for example, some of the treatment you need is radiotherapy.
Yeah,
radiotherapy. And the whole country, you only have radiotherapy in two cities, in Eldoret and in Nairobi.
Yeah.
Now, majority of the equipment for treating cancer is in Nairobi, where you have all the major hospitals, the main hospital, Nairobi, Kenyatta, Aga Khan, Mpisha, and Texas. They have the radiotherapy equipment because this is expensive equipment. But this is all concentrated in Nairobi. Then I think you have one or two equipment in Moi referral. Yes, and this serves the entire country of 47 million. This is grossly inadequate. Okay, that's one. Two is personnel, maybe more important. Yeah, because how many oncologists do we have? We probably have less than 30 medical oncologists and less than 10 radio oncologists. So when you look at that, and most of them again are concentrated in the main cities.
Nairobi,
so that makes it a challenge. Yes. Yes. And so that makes it quite a challenge. It means that most people have to try and find their way here for treatment. And so, and again, also the same facilities we are talking about for diagnosis. You know that the most important thing for cancer is picking the disease early. Because if you pick most cancers early, then you can talk about cure. But about 60% of our patients present with what we call stage 3 and stage 4 disease, which is fairly advanced. And so that being the case, then you expect that we are also going to have more deaths. Or these people don't live for long because they already come with advanced disease. And that will be occasioned by lack of facilities that can pick these diseases early.
Yeah,
so those are the main challenges that we actually have in terms of managing cancer.
Wow. That is very unfortunate, I must say. But before I let you go, Dr. Joseph, the HPV vaccine that was rolled out in 2019, and they say this is a vaccine that will help to reduce cases of cervical cancer. And most Kenyans were actually against this. Now, as a practitioner, as an expert, would you advise a parent to take their 10-year-old daughter for the HPV vaccine?
I think I would, because even my own daughter has had the vaccine.
Oh, wow.
At the end of the day, right now we have the social media has really caused a lot of confusion in the world with we have the people we call anti-vaxxers. These are
Yes.
people who, yes, and they write all sorts of things about vaccines. By the time the HPV vaccine was introduced, of course, it had undergone rigorous testing. Yeah. In fact, so rigorous, it's taken years to develop that vaccine, and the safety profile has been shown. Yes, we agree. There have been cases where there have been deaths. There have been people who have become paralyzed and various other fairly serious side effects. But now you'd have to look at the benefit of this, and especially for us.
Yes.
Remember, for us, cervical cancer is the commonest cancer among women. And this is known because we know there's an infectious agent, the human papillomavirus, that actually is associated with causation of cervical cancer. And you can give a vaccine that can actually prevent this.
Yeah.
So by and large, most studies have shown that it's a safe vaccine. But again, I think the best thing usually would be to sit down with your family doctor or your gynae, and then you go through the pros and the cons, and then you can make up an informed choice. But I think the vaccine is fairly safe.
Wow. I like that. And from a surgeon's point of view to our viewers, I do believe you. I hope that it's actually high time we reduce the number of deaths that are caused by cancer, and especially in our country.
Thank you.
All right. Well, I'm so grateful, Dr. Joseph Githaiga. Thank you so much. And I am grateful. Have a beautiful evening.
Same to you, and have a good evening.
You too. Well, that has
Bye.
been bye-bye.
More of our shows, log on to www.familymediaonline.com to enjoy a wide variety of programs, from current affairs to testimonials and features, pastoral and inspirational shows, kids entertainment, and so much more. Also stream live on www.familymedia.tv.